Welcome to Music and Medicine on Monday, a collaboration between the College of Medicine and the School of Music here at the University of Iowa. This program is designed to help musicians play and to stay healthy. Today's podcast is focused on performance anxiety, and now we'll be focusing on medical therapy for performance anxiety for musicians. More detail is available on our free medical website called the Iowa Protocols that can be searched for by Googling Iowa Protocols Music and Medicine on Monday. We're coming to you from the recital hall at the beautiful Voxman Music Building in the School of Music at the University of Iowa. My name is Harry Hoffman. I'm a physician at the University of Iowa, and our featured performer today is Wonjung Kim, a doctoral student obtaining her DMA in piano at the University of Iowa. Our other guests today include Tammy Walker, the director of the University of Iowa School of Music, an accomplished performer, professor of piano, and Wonjung's mentor. Hanna Zembruska is a clinically active psychiatrist here at the University of Iowa. And I'd like to introduce Heather O'Donnell, who is an internationally recognized expert psychologist and artistic systemic therapist. We'll have to have a definition of that in the course of our discussion. She's zooming in remotely from her office in Cologne, Germany. Wonjung, you have chosen a piece to play addressing some musical skills, perhaps some anxiety-provoking musical skills. Can you describe the piece you'll be playing?
Yes. In terms of performance anxiety, I experienced a lot of symptoms in the forms of stiff body, cold hands, and even shallow breathe.
Were those incurred at all in the process of preparing for Joy in June? Is that the second piece you're playing?
Yes.
Can you describe a little bit more about that piece?
Sure. Yeah, I'm gonna play Joy in June, composed by Florence Price. She was African-American female composer, and this piece is really playful and joyful. And I feel like when I think about this piece is creating the celebration of life, of small joy. And this one is really playful, so I hope you like it.
That's the reason you chose it?
Yes.
Great. Well, I'm looking forward to the performance.
Thank you.
Wonjung, that was beautiful. Tammy, do you want to make a comment on Wonjung's performance in the context of the anxiety we're discussing?
Yeah, I agree. Very, very well done. Beautiful piece. Again, you probably noticed she was playing that piece by memory. So there's certainly a level of preparation that she had to have in order to navigate that with great success, which of course you did because of your many layers of preparation that you had for that. One thing I would like to mention is there are sometimes specific challenges with playing pieces that are have a fast tempo, which this one is. And it can be more challenging when you are experiencing performance anxiety, especially to open with a piece on a program that is of high velocity and fast moving notes. Oftentimes, just not because you have lack of energy, you usually have too much energy when you are starting a performance and you're trying to control the extra boost that you're experiencing. But the concerns can be that sometimes your hands don't feel as supple as they normally would. You can feel like a little bit more constricted. The hands, the actual muscles can feel like they're not moving at an optimal rate, which they do much better when you have a little level of relaxation, especially outside of the fingers, the wrist and the elbow. If those have frozen up, it's very, very difficult to play quickly with success. So we have to really focus on from the wrist up, we talk about when playing at fast tempos.
So we're going to focus on some medical treatment. My understanding is that you had tried beta blockers once and didn't find much benefit from them for anxiety?
I think so.
Yeah. Well, with that, Hannah, do you want to go into the medical realm as far as managing performance anxiety?
Yeah, of course. I think it's so wonderful that we're talking about music performance anxiety because we need to normalize it. You know, it shouldn't be something that is hidden. Many individuals struggle with it, and we need to talk about it and normalize it so that individuals can get the proper help that they need. So everything that I'm going to be talking about, I really encourage individuals to discuss with their primary care provider or psychiatrist so that the provider has all the information that they need to see if you would be someone that could benefit from a medication like a beta blocker or not. And again, normalizing anxiety, I do want to say, you know, the prevalence of social anxiety disorders in the United States is about 7%, but music performance anxiety is about 15 to 25%. So, you know, it's out there. People are experiencing this beast. So one of the medications that's commonly used is a beta blocker. And it's called that because it blocks the beta adrenergic receptors in various parts of the body, including the heart and the lungs. And the generic name, or the most common one that's prescribed, is propranolol. Sometimes you might have heard it called inderal. That's the brand name of it. So propranolol is very good at treating the somatic or the physiological symptoms of that fight or flight response. So if you're having a tremor, you're having sweaty hands, you are physiologically feeling the anxiety, it can reduce that. And with that, hopefully increase your confidence and your comfort with your performance so that it can be a smoother performance. Obviously, things are not one size fits all, and some individuals may not find it beneficial, some may find it beneficial. Usually for music performance anxiety, you don't need high doses. You can take 10 to 20 milligrams. You can go up to 60 milligrams, but usually 10 to 20 milligrams is the dose that's needed. And you would take it maybe 30 to 60 minutes before your performance. So this is not something that you're taking on an everyday basis. You're kind of taking it as needed before the anxiety-inducing performance. And the duration of the medication is actually 4 to 6 hours. With this medication, just like with anything, there are things to consider. So for example, if you have asthma or COPD, emphysema, this is probably not the medication for you because it causes constriction of the muscles in the lungs, making it more difficult to breathe, and can trigger an asthma attack or a COPD attack. So that is something that you should disclose to your medication prescriber. So I was reading research that actually, if a musician is using their voice, you know, like a wind instrument or a singer, maybe propranolol is not a good idea because it has that effect on the smooth muscles of the respiratory tract. So it can dry things out, it can affect the vibrato, so maybe not a good thing. Also, propranolol beta blockers do affect the heart rate. They cause a slowing of the heart rate, a bradycardia, which when you're anxious and your heart rate is, you know, it's pounding in your chest, that is a good thing. But interestingly, they did do a research project where they looked at the heart rate of a musician performer, like a pianist, And the heart rate during a performance can go up to like 140 beats per minute. So you're actually having a fast heart rate or tachycardia, and that is needed for the performance. And so again, it might not be effective for that musician that needs it to have that bradycardia, even if it helps the anxiety, because you need that cardiac output during the performance. So that's something to think about. So the effects on the lungs, the effects on the heart rate, it can cause low blood pressure or hypotension. And that's actually one of the FDA-approved treatments of propranolol, is the fact that it treats hypertension or high blood pressure. So that was why it was originally developed in the 1970s, is to treat that. And so it causes hypotension. And again, could make you feel faint. You already feel faint from your anxiety, and you take the beta blocker and you feel maybe more faint. Another reason why maybe a beta blocker might not be for you is if you have diabetes, especially diabetes where you use insulin, because it can mask the symptoms of having low blood sugar or hypoglycemia, which would be tremor, a fast heart rate, things like that. It can mask those symptoms, and you might not know that you're experiencing a low blood sugar episode, which would be very dangerous. Another thing with the mechanism of action of beta blockers or propranolol is that if you, for example, have an allergy to something, for example, you have a food allergy and your food allergy is to the level of anaphylaxis, where you would need to administer epinephrine in an emergency. If you have propranolol on board, it will make it more difficult for that epinephrine to act in that anaphylactic episode. So a lot of things to kind of think about and discuss with your either primary care provider or psychiatrist that should be able to prescribe this medication. So I encourage everyone to not obtain propranolol
from a friend.
Yeah, from a friend. I encourage you to get your own prescription so that you can disclose this information so it can be done safely, because it is not, a completely benign medication.
Heather, can you jump in and offer some personal experience or thoughts on that?
Sure. I'm so glad to be speaking openly about this. And I, at the end of my career, I was struggling with chronic pain, lack of sensation in the fingertips, injury, and a serious case of burnout. It was just awful to perform at that point. And it was also nerve-wracking. And I was taking beta blockers. I was taking propranolol. Remember it was a 10 milligram pill, and I would take about 7.5, take about 3/4 of it. So I don't know how much placebo effect was in there, but I do remember the effect of having this almost constant anxiety, and then it's just kind of reducing, and it got me through these really difficult performances. But I do want to say, there is a flattening effect. I think these, as with any of these psychopharmaca, you have to weigh the benefits and the risks. So as an example, if somebody has a severe depression and they take an antidepressant medication, of course, this enables them to have a life and they can be in the world and do the things that they want to do. But there may be some things like a flattening of effect, or might be like a flattening out of their experience of life. And there's always this like payoff. And I think this is not clear enough for a lot of musicians who take them, that there is a payoff. And it could be, as Hannah mentioned, it could be the rhythmic control. For wind players and singers, it could be the effects on the respiratory system. And as I mentioned, like the emotional flattening out. So these are some things to take into consideration. And if somebody can't function without it, of course, it's a tool, and it's perhaps the best way seen as a way through. If somebody's on them forever, I would really suggest seeking help. For like they can be bridges from one part of life to another part of life, but if they're taking it for like ever and ever, it's challenging. I also want to mention that it gets into some systemic issues about what I mentioned before, like this perfectionism. I've heard of some teachers like pushing the pills on their students and saying, take this before this audition because you really need to get this audition. It will make me look good. And this is something that really has a whiff of a drug dealer, and it's really a systemic problem. So when in our music culture, perfection is so high, and we don't think about like the human cost of it and the other options that are available and getting other values in the room, then it becomes really problematic, the use of beta blockers. But on an individual level, when it can save somebody's career and when it can save somebody's relationship to music, I wholeheartedly support them in using them, especially as a kind of transitory stage.
Well, it's considered a performance-enhancing drug that's been banned by several sports because it does steady your aim when you're shooting a gun or performing in those types of modalities. There are some articles supporting its use in the field of ophthalmology with some randomized prospective trials, one of which did look at anxiety, which decreased the anxiety of the residents working with some taskmasters as professors. But it also helps steady their hands. There are some comments about making your hands like rock, and there are a number of surgeons that use it routinely for very fine, delicate surgery, and I think that's not advocating for it, but noting that it's done legally and probably appropriately with some support from the literature. Tammy, you had some questions. Say you have a student who may benefit. What you say you prescribe?
Oh, I prescribe articles. Yes, I certainly have no expertise in this area at all. So yeah, I had a question for you. I mean, what your advice would be to a teacher that has a student that is interested in exploring this option? What should teachers tell their students?
Yeah, I think this could be a tool, in a huge toolbox of cognitive and behavioral strategies, and pharmacology can just be one of them. I think the teacher should support the student, and it never hurts to just have a conversation. The student can go to, again, primary care, psychiatry, have a conversation. Is this a medication that I should try? It doesn't cost anything to have that conversation. And if a student is prescribed it, I would recommend that they try it in a non-performance setting first. If this is something that is safe for them to use it in a low-threat situation, rather than saving it for that very important performance, because it might not perform the way that you think it should perform.
And we'll insert a small session from a previous recording identifying a physician-musician who used it, and his mentor who was initially against it, but then came around and thinks that it's actually a very useful modality.
Growing up and going to college and become a young professional, I always had this attitude: if I need to take a drug to be able to do my art, maybe I should be doing something else. And that attitude has changed tremendously over the several decades, because understanding what the medication like inderal does, is beta blockers does to you, it allows you to become a musician in a way that's more honest to what you think and are and have developed as you.
So you think there's a valuable role for it?
I think there's a valuable role. I think it needs to be well monitored. I was even considering start taking it, and then I learned about some different kind of breathing techniques that has helped me. So I haven't taken that step to even try, but I know many of my colleagues do take it, and I don't pass judgment anymore like I did when I was a 20-some-year-old, saying like, oh, if you have to take this, you should be doing that.
I first took beta blockers in 2002, maybe 2003, and that was, it changed my performance completely.
So you took it because of performance anxiety?
Yeah, absolutely.
And some people take it for tremor.
Yeah.
And it's
so I continued taking it.
Yeah, is that right? So it was more for performance anxiety.
But anyway, yeah. So initially I took it for performance anxiety, and the change was dramatic. And
favorably.
Yes, absolutely. Now some people have different side effects and things like that, and it doesn't work for them. And so that's, fine. But for me, I didn't, and it worked really well for me. And I think that led me to be able to, win my first auditions and get my first jobs and all those things. And so it really allowed me to pursue that dream in a way that I probably wouldn't have been able to otherwise. Although maybe if I had your breathing techniques, I would.
So Hannah, do you have some other drugs we can talk about? One of my favorites to talk about, alcohol.
Alcohol? Yeah, why is it one of your favorite ones to talk about?
I think I've talked more about it than any other drug.
Really?
Yeah.
Really? Maybe we could talk about alcohol in a pill,
Okay.
which is benzodiazepines.
Okay, let's talk about benzodiazepines.
So the other medications that could be utilized are benzodiazepines. You might have heard of like Xanax or Klonopin or Ativan. Those are all brand names of benzodiazepines, and they can be considered alcohol in a pill because they work on the same receptor in the body, the GABA receptor, just like alcohol does. And just like alcohol, you can develop a tolerance and a dependence and unfortunately have a withdrawal. I would encourage students struggling with music performance anxiety to maybe focus more on the beta blockers, propranolol, rather than the benzodiazepines, because there are these negative realms, the tolerance and dependence, the withdrawal with benzodiazepines. You can get physically addicted to them, and these are actually controlled substances. Benzodiazepines are controlled substances, but they could be, again, utilized on an as-needed basis, and conveniently, these pills are made to disintegrate. Many of them come in a form where you don't even need any water. They just disintegrate in your mouth. And again, some of them have kind of shorter durations of action than others, and you would take a small amount, again, 30 to 60 minutes before the anxiety producing performance, and manage your anxiety that way. Propranolol does cross the blood-brain barrier and may have negative cognitive effects, but a lot less so than benzodiazepines. Benzodiazepines do actually cause sedation, just like alcohol can cause sedation. With alcohol, I do not recommend utilizing alcohol as a treatment for any type of anxiety, but it is commonly utilized. Again, it works on that GABA receptors, just like benzodiazepines. At a certain level, though, the calm, the anxiety-reducing properties of alcohol can actually kind of work against you, and it can increase your heart rate and actually cause anxiety. So you have to be careful with that treatment too. When you have talked about alcohol in the past, in these sessions, what has come up?
I think this is the first time it's been broached in this session, but every band I've ever played in, it was a major component of the band. In fact, one of the leaders of the band had a 2-beer minimum before he would perform in front of people, which I didn't practice, and I found playing jazz, you shouldn't have anything to drink before then, at least for me. But it tends to work. It decreases anxiety, but these studies addressing surgeons taking beta blockers cautioned against benzodiazepines. They didn't even mention alcohol because of the impaired judgment that can come along with both of them, the benzodiazepines and the alcohol.
So there was an interesting study where they actually had groups where they did give them alcohol and they measured their anxiety. So this was not in musicians, but in individuals who had social anxiety and social phobia. And there was a group that were told that they were receiving alcohol, did receive alcohol, a group that were told they were receiving alcohol, no alcohol, and then a group that did not get any alcohol. And not only is the alcohol the anxiety reducing piece, but if you are being told and you think that you are consuming alcohol, that also, just the psychology of that has an anxiety reducing aspect to it, even if you were given water. So just because you think that you're being given alcohol can have a calming effect, an anxiety reducing effect. I don't know what you think about that, Heather.
Thanks for bringing me into the conversation. There's so much to say, Hannah. It would be really hard to imagine, as a classical pianist, classical musician who needs such fine control over the motorics that they could even think of taking a drink before performance. It might be effective in decreasing anxiety, but it would be super ineffective in being able to play the piano or being able to play another instrument. But I do know that so many musicians use alcohol in an extremely vulnerable time, which is after the performance, to come from the high of the stage and the anxiety preceding the stage to get to a level where they can rest. And this is in the populations, the classical musicians and jazz musicians with whom I work, this is really a problem of using alcohol to self-medicate in that very, very vulnerable time.
So the question about the difference between performance anxiety as a natural problem or a problem with somebody without other difficulties, and depression and social anxiety that might require the serotonin reuptake inhibitors. I don't know the official words for the antidepressants. There's some in the literature about treating anxiety and perhaps performance anxiety with some stronger antidepressant medication.
Yeah. I would encourage, if a student has more than just music performance anxiety, if there is a generalized anxiety, a social anxiety, maybe a depression, those disorders are better treated with more than just propranolol and benzodiazepines. They're better treated with SSRIs. You might have heard of medications like Zoloft and Prozac, things like that. That is really the ideal treatment for that. The other class of medications would be SNRIs that work on serotonin and norepinephrine. Those are medications you might have heard of, like Effexor or Cymbalta. But again, that would be best determined by talking to your provider. They can do a thorough history and assess, is this just kind of like a very focused anxiety, or is there something more going on? And a broader treatment needs to be had. Mm-hmm.
And so Heather, is that consideration that Hannah just described something that might lead you to have a colleague in psychiatry that you might call upon? Do you work with a psychiatrist?
I don't work specifically with a psychiatrist, but yes, I would love to. So I might be reaching out to Hannah in the future and just getting her advice, because this is such an interdisciplinary field. Nobody can go it alone. We're all parts of the puzzle. So we work, psychiatrists work with psychologists, and I don't want to leave out people, working pedagogically with musicians. It's so important that there's kind of a dialogue because we all have different expertises and insights into what's going on. And there's a place within music medicine for all of these inputs, and you can't do it on your own.
So do you all have any other questions for our psychologist and psychiatrist?
I have a specific practical question. We talked about propranolo.
Propranolo.
Yes, propranolo. And I have a friend who drink coffee, and after coffee she took the pill. I saw that. In that case, is it safe to do that at the same time?
Yes, with
Is
caffeine.
Okay? Yes, caffeine.
She might. So one of the other FDA-approved reasons to take propranolol is an essential tremor, and sometimes caffeine or something can exacerbate that. Yes, that can be that is safe. Yes.
Okay.
So one of these articles assessing surgeon performance, ophthalmologist, compared a group that had just caffeine, a group that just had propranolol, and a group that had caffeine and propranolol. Yes. And the best group was the one that had no caffeine, just the propranolol. The next best was if you took propranolol after caffeine, you blunted some of the bad effects of the caffeine, so you're almost like you took nothing. The worst was with the caffeine.
I see.
Great.
Thank you.
Yeah, of course. I did want to touch on something that Heather was talking about. So working, a psychiatrist and a psychologist, again, I want to emphasize that propranolol and other pharmacology, it's really only working on the physiologic effects, the somatic effects. There's still the psychology of everything that we've talked about today. And so it is not treating that. And so that's where the partnership can be valuable. We can probably very easily get rid of that tremor and get rid of that heart rate, but that perfectionism is still there. And, if you had a negative performance recently, and that negative self-talk is still there. And so that's why you need that other piece that Heather is treating.
Terrific. Wow, what a cooperative, collaborative effort that is. I appreciate all of you. Won-Young, Tammy, Hannah, Heather, thank you very much for a great performance and discussion. Additional detail regarding this and other episodes of Music and Medicine on Monday can be accessed by visiting the Iowa Protocols by Googling for our website that's free for the Iowa Protocols Music and Medicine on Monday.